Hi everyone. After a long gap, again we are meeting. This time we are going to talk about NAADI, the very fascinating topic. But I am not going to talk in a fascinating way because when you talk science, it don't be so fascinating, no? It don't be so attractive at all. Here, let us dive deep into the subject. Number one, what is NAADI? Before coming to NAADI, you should know certain things. When you become a clinician, you will have your own way of approaching things, approaching challenges, approaching decision making. Sometimes a bit heuristic. The heuristic means it's a mental shortcut. With your past experience, you can pick certain things immediately by some pattern recognition. Here, NAADI is also an intuitive pattern recognition, which is a bit systematic, influenced by sensory inputs, sensory as well as visual inputs. Here, sensory input is not the typical sensory input the technology is talking about. It is about our three fingers. Through our three fingers, by fiddling the patient's forearm over the radial artery and picking the pulse, either arithmetic or the humeral, whatsoever, in which way you are comfortable, by extracting certain information, we use those data to compare the data which is already stored in our brain. Unconscious storage of information in our brain is already there. Without your knowledge, it will be there. Our only job is to observe things. Everything will be in your brain. You need a pattern. You need a technique to bring that data out from your memory. That's why you shouldn't be in prejudice or emotionally attached with the situation or so tense. You should be so relaxed. Yes, you should be very careful, caring, but not with blooming emotion. When a patient comes, you know his name, his age, his gender, his religion, his habitat, his family history, everything you know. After knowing all the primary profile information, then you are listening to his history, his sufferings. While he narrates his issue, you should judge. You should be able to judge his ability to tell his disease. While narrating, sometime it depends upon his emotional attachment with something or with his belief. Patient may not be able to tell properly. Then we have to interfere and help them to give the proper history. For example, a male at the age of 40 will tell you his erectile dysfunction, not about the pain while walking. A female may worry a lot about hair fall, not about blood in motion. So this is where we have to we have to interrupt, professionally interrupt and help them or guide them to talk in a sensible manner, irrespective of patient's education status. We have to interfere in that area, but not immediately. We have to listen adequately. Then while listening, you may come to know this is the area we have to interrupt and give guidance regarding how to talk and how to narrate. NAADI means, this is NAADI. As you believed, it is not a single shot magic bullet. No, it is a NAADI is, in a Tamil, the meaning of NAADI is approach. Knowing NAADI, knowing Mudal NAADI. Avani NAADI, Udavikaga avani NAADI. In that sentence, what is the meaning of NAADI? That is the meaning of NAADI here also. So it has everything. Knowing an NAADI, avan Vidi NAADI, avan Mori NAADI, Undi NAADI, Karan NAADI. The Karan NAADI is that has been isolated and blown out of proportion. That is the only thing in NAADI. Not like that. NAADI is just approach. How you approach. NAADI is an ancient method of approaching a patient. That's simply. Karanadi is the NAADI we are talking about. This Valiyadalayam and all. Coming to the main topic, intuitive pattern recognition. And using that, when you recognize some pattern, we should be able to compare the present situation or the present challenge with the past experience, if any. If you have anything, a trace, even sometimes some case studies might be there bit incomplete, you may know. some pattern may be easily compared, but not absolutely, but little bit. Then you can go back to that case history and follow that, and you can use that here. It is bit heuristic. Heuristic means mental shortcut. Sometimes you may not know how you picked that. If somebody asks you how you picked that, you may not be able to answer it properly, but you can do that. For that, you should be in the position for a longer period, listening to patient, listening to, seeing histories, interpreting information, data, everything. Already your brain is stored. Your brain has stored massive, diverse data regarding patients, challenges, decision making, results, and all the backfire also. Whatever the repercussion also, your brain will have it. If you are emotionally attached with a past, sometimes it will alert you. If the reward system has that data, reward system means when you had a very successful career, sometimes the reward system will tell you, no, already you have done this. Then you will become, whether you are becoming so tensed or become thrilled, depends upon your past experience. If you had a very great experience with the past history, you will be thrilled. If you had a disaster in your past, you will be a bit tensed when you approach that particular patient. It will depends upon whether it's an alert or a thrill. Depends upon your past history. Here, NAADI. What is NAADI? NAADI is a digital sensory input. The radial artery fiddling and observing Mukutram is a method where the only area where a patient can extend his hand to get examined by the doctor. That's why it is so special. No, sometimes you can sit your own chair and just when it is that olive branch has been extended to you, you can fiddle it out and get some sensory input. That sensory input will become a part of other data, listening what you have listened and what you are seeing, whether some signs or investigation reports or scan whatsoever. Family history, everything is an information. Even accusation is an information. How accusation can be information? We might have given some medicine. Patient may tell you after taking that medicine, if he says I became all right, we will be happy. But if he says, sir, after that I have some diarrhea, that's an information. It is not an accusation. So all the information, everything is an information for us. Everything, whether an appreciation, a criticism, whatsoever, everything is an information for a doctor, to a doctor. Sorry. So you have to collect all the information, and we have some subsets of data. So we should interpret it and recognize the pattern and reinterpret it. First interpretation is getting data, then among the data we have to reinterpret all those things with results and all. Quickly we have to go to go to decision. Here NAADI will help you to circumvent the step-by-step evaluation. It will take some time. It will take some time. It will give sometime bit expensive also. But NAADI will help you to cut down all those expenses, but not at the cost of perfection. Perfection shouldn't be compromised. That's why you need a very big data in your brain, massive data. Perfection decision making, it's life saving. We are dealing with the life, so we cannot do all on trial and error always. It is a heuristic approach. You can give something, get a result. We may fail, we may succeed, but not in this case. Heuristic can be used, but with some backup options. So coming to NAADI, already we know that it's a digital recognition of some sensory inputs from patients to recognize deranged Mukutram, Valiyalayyam, depends upon the patient's age, sex, as well as family history and other informations. This is NAADI. NAADI will help you to locate the locus of the disease, not the disease. It won't tell the disease. It will help you to locate the locus. Locus means the The locus, you know that, I can't explain more. The locus of the disease and which direction it is going, in which direction it is going, influenced by what, aggravated by what, all those things NAADI will tell you. NAADI won't tell you. NAADI is a data, then you have to interpret it. Because we have only 9 type of NAADI. Arithmetic only 9 NAADI is possible. Then all these subsets, all these verticals. Only 9 possible, not the 10th is not possible arithmetically. Clinically also it is not possible. Only 9 we have, 9 types of NAADI only we have. But we have lot of almost according to Siddha system, there are 4,445 diseases with 9 NAADIs. So NAADI won't tell you anything. NAADI will be there and you have to interpret it. Interpretation, pattern recognition, interpretation, intuitive pattern recognition, and interpretation and decision making. It is adding up. Everything is adding up. So everything is all about how sharp you are. Unless you are experienced, unless you have seen a lot of patients, this technique won't work at all. It won't work at all. You can cheat people that they are seeing something, but it won't work at all. I will explain you. Volitional NAADI is a NAADI for pregnancy, conception. Yes, it's a classical NAADI for conception. But it is the toughest NAADI is volitional NAADI because the normal NAADI and volitional NAADI also the same. It mimics. It is like Klebsiella oxytocin and Klebsiella pneumonia in under microscope. Both look similar, but you will confuse all the microbiologists. Under microscope, it is not easy to differentiate Klebsiella pneumoniae from Klebsiella oxytocin. But it is clinically very important because Klebsiella oxytocin can cause spinal abscess 10 times higher than Klebsiella pneumonia. It can cause subacute endocarditis. It can cause brain abscesses, meningitis also. Oxytocin. But under microscope, both look similar. Only experienced clinical microbiologists can pick it up. Same can be applied to volitional NAADI and normal NAADI pattern. So when it comes to SOP, it's different. SOP of NAADI, no, standard operating procedure for NAADI is completely a different topic. But after everything, what you pick up, what we pick, we come to one of about 9, SN9, no, Sadhaka NAADI 9. One among the Sadhaka NAADI 9, that is a final one, final input. That input, that is not the end of the story. That input has to be properly recognized, applied, and we have to come to a decision. Everything within 1 minute. No, only it takes only 1 minute for you to, while talking to the patient, you are seeing the NAADI. NAADI will help you whether they are giving the proper history or not. That's the first plus point in NAADI. First advantage. NAADI will tell you whether the patient is narrating proper history. Sometime, for example, if a patient is recently, 2 years back, few years back he was diagnosed to have hypertension. He was on certain drugs, but few weeks back he was given, his drug was changed from some other drug to this one, atenolol, a beta blocker. NAADI will tell you a story. Patient may have asthmatic attacks frequently, even though he was the patient is known asthmatic. Only for the past 3 weeks, it is so impactful. Then you can find out there is nothing new. No, patterns are not, they are the same. So there is no new disease. So some trigger factor from outside, this exogenous factor became endogenous. That is a drug. So then you can switch on your history taking from disease to his drug history. NAADI will help you in the missed piece. Always there will be some missed piece in clinical diagnosis, especially in rheumatology. The NAADI will help you to pick that missed piece. That's I will tell you. I will explain you later in another video. At present, bye. I am Dr. Balamurugan, a clinician from Chennai. Bye.